In this second session of Module 1, I'm going to talk about what is autism, what causes it, and what's the meaning of spectrum in autism. And I'm going to take some of the questions that are commonly asked by parents about autism. Autism is a neurodevelopmental condition. It affects the developing brain of the child. Now, in the brain, there are two main components. There are cells or neurons, which are mainly formed by the time the child is born. Then there are connections between these neurons, or the wiring, and that keeps forming for many years after birth. And it keeps forming and it keeps changing depending on experiences. And there are changes seen in these two components in the brain in autism. Now, as a result, the way the child perceives or makes sense of information such as language, communication, or social interaction, that is somewhat different from other children. And because that perception or making sense of that information is different, the child's responses to communication or to interaction is somewhat different from other children. Now, these changes tend to occur in three main areas: in language or communication, and in social interaction, and in the imaginative aspect of the child. Now it is asked, so what is causing all this? Well, as we said, it is a genetic condition. So there are subtle changes happening in some genes that are being passed from parents to the newborn. Now, what's causing those changes? Well, some of those changes just occur. There are always changes happening in genes. I mean, that's why no two children look alike in the same family. But there are some changes that are causing autism. Sometimes there is autism in the family, and that's why it is being passed down. But mostly, most parents or others do not have autism. And these changes are happening. Why? We do not yet understand exactly what causes these changes in the genes. But one thing for sure, that parenting or something the parents have done does not cause autism. It's wrong to blame the mother or the father for causing autism, and even social circumstances. I mean, they may make a difference in how a child with autism learns or doesn't learn, but it does not cause autism. As I said earlier, there are three types of difficulties that are seen in autism. Children with autism are either late in learning to talk, and sometimes very late, but many children do learn to talk. They often have a difficulty in learning to use the language. They use the language in a slightly different way than other children do. For example, either they will talk using a more formal language, or they will use repetitive words or phrases. The second area of difficulty in autism is with social interactions. Now, many children with autism lack an interest in mixing with others, and many other children with autism lack the skills of mixing with others. Some children with autism do have an interest in interacting, and they do have some basic social skills as well. But they find it hard to mix in some other situations, like when they are meeting new people, or when they are in group situations, or when social situations are changing. That is extremely hard for them to deal with. The third area that's affected in autism is repetitive behaviors and restricted interests. Now, most people with autism like routines. They don't like changes. They get very stressed out if things change. Some of them also like doing things in a certain, almost like a ritualistic way. They always have to do some little act or in a certain way whenever they do a task. Now, many children with autism also lack the imaginative aspect in their play. They like playing with certain type of toys or only in a certain way. They can also have excessive interest in some specific things or topics, like knowing a lot about dinosaurs or trains or numbers or shapes or colors. Now, some children with autism have certain sensory interests. They like looking at things very closely or looking at things from certain angles, or may not like some sensations. Like many children with autism don't like certain type of sounds, and they'll become very upset and cover their ears if those sounds are there. Some children with autism also have certain unusual movements of their fingers or hands or body, and they will show those movements repetitively. So some or all of these repetitive behaviors or restricted interests are often seen in children with autism. Now, a question is commonly asked: at what age does autism begin to appear? Now, we talked about earlier that the changes in the brain start even before birth. But the differences of autism in behavior are usually not apparent till about 18 months to 2 years of age. And in most children with autism, the changes become apparent by about 4 years of age. But there are some children when parents or teachers, and sometimes even children, become aware of the differences much later, when they are 7, 10, or even older. But these are few. Most of the changes are apparent at the age of about 4 years. Now, do children with autism have other difficulties as well? Well, about 2/3 of children with autism have some degree of intellectual disability or a learning disability. And that affects almost every aspect of their function and life. It affects their learning, and it affects their self-care and their ability to live independently. But the degree of this intellectual disability, it varies. So not every child with autism has an intellectual disability, and only a small number have a severe intellectual disability. Like other developmental disorders, children with autism also have other coexisting conditions. For example, many children with autism also have coexisting attention deficit and hyperactivity disorder, or ADHD. Now, some children with autism have atypical movements and postures, and many children with autism have difficulties of eating, drinking, sleeping, difficulties of their mood and behavior. And it is important to recognize this, because it's not just enough to say the child has autism, because the child may actually be affected by some other condition much more than they are affected by autism. And the other condition may actually be treatable. And the child's behavior, learning, and outcomes can improve a great deal if this other coexisting condition can be treated. So what is the spectrum of autism? But we know that every child with autism is different. The way autism affects a child is different. The way the child develops is different. Some people think that the meaning of a spectrum is that some people are less autistic and some people are more autistic. Well, that's clearly wrong. What this spectrum actually means is that children are different in different aspects of their development. And that is what makes it a spectrum of autism. And that is why it is important to look at the whole child, look at their functioning in different areas, so that we know where the need is for helping the child. A question is often asked: is there a treatment for autism? All parents want their child to get better, and they try various things. But there is no medical cure for autism. There is no injection, there is no tablet that will treat autism. But if the right method and approach is used, then, like all other children, children with autism also learn, they also change. Now, given the right input, you can also change the child. You can also change the developmental trajectory of your child. How much your child will change depends on what other difficulties your child has. But change, yes, your child will change. Now, some people will try to sell you a treatment or a magical cure, such as high dose of vitamins or minerals or other medicines, or even stem cell injections. Now, these things, unfortunately, do not work for autism. They do not treat autism, but they can harm your child. So be aware of this and stay away from such people. So in this module, I talked about what is autism, how does it affect children, and what is the spectrum of autism. Now in the next session, the third session of module 1, we are going to talk about the obstacles that autism creates in the path of a developing child, the way it stops or slows down the learning and the development of children. And that we will discuss in the third session.